My name is Dr. Syed Arshad Husain. I'm a consultant pulmonologist. I'm also an adjunct professor in pulmonology at the Gulf Medical University. We were discussing obstructive sleep apnea, and we were discussing how to diagnose obstructive sleep apnea. Diagnosis is usually made on the basis of apnea and hypoapnea. Now, apnea means complete stoppage of breathing, and hypoapnea means some reduction in the breathing at night time. And we call this AHI index, apnea hypoapnea index. The best thing is to do a polysomnographic sleep study which picks up apnea and hypoapnea index. And this is very important to see how many hypoapneas or apneas a patient is getting. Based on that, we decide if they are mild category, if they are moderate category, or if they are severe category of obstructive sleep apnea. So apnea hypoapnea index, if it's 5 to 15, we call it mild. If it's between 15 to 30, we call it moderate obstructive sleep apnea. If the AHI index is above 30, we call it severe obstructive sleep apnea. For mild sleep apnea, we discuss a conservative plan of management, and they would benefit from mandibular advancement device. But when it comes to moderate or severe sleep apnea, then they need to have treatment from CPAP. Now, CPAP is a machine which puts air under the pressure. So it's called continuous positive airway pressure, CPAP, CPAP. So this is the treatment of this condition and has a very high success rate. The difficulty is the first 1 or 2 weeks of starting this treatment with a mask attached to a tubing to a small box like this. It's very difficult for patients to tolerate that. So first 1 to 2 weeks is difficult, but as they get used to using this machine, this works wonders. Sometimes if the CPAP treatment fails, which is very rare, then we have to look at other possibilities. Now, other possibilities are surgical possibilities of treatment, and that's uvulopalato-plasty and various other palatal surgical techniques that can help patients, but the success rate is not as good as the CPAP offers. Hence, we always offer CPAP as the right treatment for these patients with moderate to severe obstructive sleep apnea. The other thing which is very important, as I say, is conservative plan around this whole issue of trying to lose weight, trying to exercise regularly, and making sure that people are getting good sleep on that. So what exactly is hypoapnea and apnea? Now, hypoapnea means the curtailing of the oxygen to the brain, but apnea means complete stoppage of oxygenation. And this usually happens at the back of the soft palate in the throat. The tongue becomes larger, and when we sleep at the night time, it goes and occludes this gap in the hypopharynx, so it's the soft palate. So there is complete blockage of air going into the brain, and though the exact mechanism of sleep apnea is not very clear, but this we feel is the main problem that leads to apnea and hypoapnea in the brain. When the brain does not get enough oxygenation, it does not go through those old cycles that I've talked about earlier, from NREM to REM sleep, and this sleep circuit is broken many times in the night, and hence the sleep is not going into a deep sleep where regeneration of the cells can happen, where memory can regenerate and recuperation of the brain cells happen. And because of that, people are sleep deprived. This affects their concentration span, this affects their physical well-being. They are tired, lethargic, not able to do their job. Sometimes they sleep on the desk while they're working, or on a car if they're driving, and this could lead to various serious injuries and accidents. So hence, sleep apnea is very pivotal in a good health of a patient, and it is also related to diabetes, weight gain, cardiovascular risk, blood pressure problems, and CVA or strokes. So I think it's a very important topic that should be addressed very, very quickly. If you feel yourself, if your partner is telling you that you're sleeping and stopping in the middle of the night, you're breathing, then don't ignore this symptom. If you are finding that you're waking up in the mornings and you're sleepy and lethargic, don't ignore these symptoms, because this all could add to a very serious condition called obstructive sleep apnea. Thank you.